Hey, do you want to know how to do a back massage? Do you want to know how I do a lower back massage? Stay and learn the secret techniques I use to give a massage. Welcome one more day, one more week to Physiolution, or your physiotherapy, health and wellness channel. Today I bring you how to perform a massage at home, massage techniques, massage intensity, what to do and what not to do to give a relaxing massage. The benefits of massage are many. Basically what we are looking for is a relaxation of the patient, muscle relaxation. Also when we rub the skin and rub the muscles, there is a hormonal regulation. We increase the heat, and that feeling of well-being is one of the great benefits of massage techniques. We are not treating a pyramidal syndrome, we are not treating a contracture. When there is a pathology, it has to be worked by a professional. Do not interfere where you do not know how to interfere. And how are we going to give this massage therapy? We have the patient lying face down. This is very comfortable because it is a stretcher and it has an opening in the head, and we can lie down on a soft area. It could be done on a table, it could be done on a sofa. How are we going to give this massage? What I say to you, we have to put a towel on it very comfortably so that the hyperlordosis is not accentuated. Since we want to relax the lumbosacral area, what we have to achieve is that this area is relaxed. There are people who lie face down and have hyperlordosis and then their back hurts. I leave you a news of what is hyperlordosis and what you can do if you have it, because it is a topic that is closely related. How does this back massage have to be? Basically, the rhythm has to be soft. It has to be with affection, softness, tenderness, as if you were dancing a waltz slowly, okay? It does not have to be energetic, rhythmic, very anarchic. It has to follow a pattern. You have to be touching the patient all the time. It is not enough to do one technique, withdraw and do another one, okay? These are general indications. The intensity is going to be medium-low. Realize that if you give a high intensity, what you are going to get is that later there will be an inflammation, and that inflammation is going to take its toll on us. We want to give a relaxing massage. We want to help the person we are massaging. We don't want them to have a post-massage inflammation that hurts more. So be very careful with the issue of intensities, which leads me to the next super important rule, which is the no pain rule. What hurts inflames, what inflames then it will hurt. So if we do a technique and the patient says to you, "It is hurting me," she is already defending herself, and we want to relax her. So no pain rule, guys. Therapist position, watch out, no injury. We can't give a back therapy and a back massage in this case, and end up with other people broken. So the rule of the tie, basically if we had a virtual tie, we are going to treat what falls directly on that vertical axis. We cannot treat at this distance. If we had to treat cervicals, we would go here, lumbars here, very close to the patient, and letting ourselves fall a little bit on top of him, not using only the strength of the arms, but accompanying, moving, dancing a little bit, moving. If you move forward and backward, the arms go by themselves, and it will help you to perform the massage technique better. We start with the massage techniques. My secret techniques to perform a massage, in this case lumbosacral, up to the trochanter and up to T12. You could go up and up because everything is correlated. But let's start at the beginning. As I always say, I will start at the beginning. As I always say, we are going to do a soft technique at the beginning with very little cream. Be careful. As I said, the more cream there is, the less you deepen. So we are not going to use a lot of cream. Just that there is a friction and that you feel that you have a good connection. This first technique is a palmar technique, in which what we are going to do is to knock on the door, say hello, how are you, let yourself be touched a little bit. We are going to move our hands very softly, making eights, one up, one down, with the palm extended, saying to the skin, come on, we are going to start doing a massage, be calm, I am not going to hurt you, let's go slowly, okay? You change position, you go with both hands to one on my body, and you work doing little circles. Very soft techniques. For how long? 5 minutes, for example. 5 minutes, a little bit of right buttock. 5 minutes, a little bit of square. Excuse me, not 5 minutes. 20, 30 strokes buttock, 20, 30 strokes square, 20, 30 strokes another square, 20, 30 strokes another square, 20, 30 strokes another square. That way we would take 2 minutes. A more global technique is to put on the approximate caudal, use the palms of the hand and go slowly, making a superficial doing a superficial massage without leaning too much. We simply want to appeal to the blood in the skin to become flexible for the following massage techniques that we start now. We started the massage techniques, the other one was to prepare, okay? It's massage, but it's not massage. We are going to work with what is the hypothenar tenar eminence, with what is the palm of the hand, this little heel that is here, and what we are going to do are longitudinal strokes. Yeah, I'm already reinforced here. It is a reinforced palmar, which is what I wanted to do. But longitudinal passes with the two palmitas and developing a medium intensity slowly. As you can see, I always have a little cream in this hand. So when I see that there is not enough cream, we can put a little bit. The same, but with a little bit of cream. The same, but from top to bottom and from bottom to top, going out at the sacrum towards the hip bones. Palmar. And now we are going to do a reinforced palmar. It is the same technique that I instinctively used at the beginning, which is the hand on the wrist. It is this technique, and we are going to work with this. We are going to apply pressure with this part of the hand. Here, what we are going to do is to reinforce the weight and let us drop with both arms. As you can see, I am not working here. I am working on top of the patient and letting myself fall. Very nice technique. We start from the bony ridge, sacroiliac spine. The little bones here, you don't need to have knowledge of anatomy to do a massage. You just feel like it. Good vibes. Calm. And then perform it with a medium low intensity and slowly. As you can see, I do not separate the patient's hands at any time. We are working with the heel of the hand, the heel of the hand, the heel of the foot, the heel of the foot. Back up. With the heel of the hand. Another way to work with the heel of the hand would be here, a little bit deeper. Would be here, a little bit deeper, and another one would be in the whole gluteal area, generating a circle. Flange of the hand, we support ourselves. Ganchamos a little bit if you want, a technique also that comes very well. And so we don't lose. As we go, we carry and bring, we do not lose travel, as the one who says. So reinforced heel. A very important technique that I use every day. We continue with the next technique, toes. Reinforce the fingers if they only squeeze like this, okay? Because in the end, we make a lot of leverage and we hurt the joints much better if with the eminence we have and strengthen the heel of the hand. What we talked about before we reinforce it, if we reinforce this technique like this, what we can do is more force with the left hand. With the right hand, it is sensitive, and we will do as I tell you. 3 or 5 minutes, the techniques of before, 3 or 5 minutes. All in all, it has to be about 15 or 20 minutes of massage, 25 at most half an hour. More than half an hour, I would not give in an area so small massage because in the end, you do not relax, you inflame. Then we make sweeps, little spaces, longitudinal. We leave the bony rim. We do the massage in the soft area. It is not worth massaging hard areas. We must avoid pressing the spine. Okay, you have to go for the soft area of the back. Reinforced thumbs for everything that is the spine. The spine, the muscles that are next to the spine, we can change the direction and go down. We reach the bone area and finish with the gluteus. I show you here. We go down, we get to the bone area, we stop making force, and we get into the gluteal area up to the trochanter, up to the little bone of the hip. You are going to be able to touch the hip, okay? We have a technique attached to the spine, 10, 20 times, 10, 20 times. We switch sides 10, 20 times. 10, 20 times reinforced finger technique, okay? Circle technique, this you have to have a good hand if you can't hurt yourself, okay? Then it's just simply to generate a left to right movement and generate a movement from left to right and coordinate with the hand. It is very good because we can do it with both hands and it is very pleasant. They are techniques of concentric circles that help a little bit to relax. We start in the sacroiliac and we stick longitudinally along the entire spine. As I said, they are techniques that if it does not work, it hurts our hand. Do not do them, okay? These are trained hands. In the end, we cannot do a pro technique. We have to go little by little, even so I teach them to you. Okay, more little things, reinforced pisiform. Well, we do this technique because many people put their big toe and start to press here, and then they have a problem in the big toe. So a good technique for all this longitudinal section is reinforced pisiform. What we are going to do is this. We put the toe in, we support the heel of the little hand, and we stabilize ourselves. The big toe is sensitive, it already knows where it is going, and what the other hand is going to do is to reinforce by putting pressure on it. We are going to do 3 lines of action. We go from the little bones, okay, from what is the hip, what is the iliac crest, the sacroiliac is here is the spine. We are not going to go over the spine at any moment, and we put 3 fingers. These are the 3 lines of work we are going to do. We put a little finger attached to the spine, and we go up slowly. 10 times. We continue on the next finger, on the next line. And 10 times in the next line, 10 times. We would do the same on this side. I'll show you on this side. Although to try that side, I would have to turn around, okay? Slowly. Slowly. We continue with a technique also very powerful, which is knuckle or fist technique. Basically, with the knuckles, you can work. With the knuckles, you can work very slow passes because they are very powerful. So very slowly, simply dropping the fist on the body, slowly taking out 1 knuckle or taking out 2. But to stabilize this massage well, it would be very good hand. 1 knuckle or 2 and we stabilize. And this way we get that the joint does not suffer, that there is a balance, that there is a guide. We can make those 3 lines of action that I mentioned before. That goes very well. And that we want to put 2 knuckles, because technique that varies, it is no longer here, but it would be like this. Working with 2 knuckles. We would change the direction of the hand from here to here. More global techniques for very big backs, totally knuckle technique. We put the little hand here. I do it without 1 hand so that you can see it, which is, as you can see, to do a rake. On each side of the spine, with the hand we stabilize, we take the big toe. We make a filling of the hand that will be more comfortable and it will hurt the hand less. And so what we do is to stabilize. I say again, soft intensity, relaxed, constant intensity all the time. There can be no pulling, no pressure. If there is pain, the patient does not communicate it in this case, and we lower the intensity, okay? These knuckle techniques are very good for the whole gluteus issue. As you can see, we reinforce, we leave the sacrum, and we go towards the hip. We go over the sacroiliac and you look at the hip. There would be 2 lines of action, 1 more horizontal, and the other a more oblique. That's it. We work more horizontally. And the next one more in oblique. How much? 10 passes in horizontal and 10 passes in oblique. We continue with more secret techniques. We are now going to use the forearm to work different zones, okay? We have the forearm to work a V here, okay? And we are going to use the reinforced forearm by passing in the ulnar zone of the wrist and finishing with the forearm drag, an elbow, we recover, we hook. We go forward slowly, helping us, and when we reach the elbow area, we retract a little bit and finish to go backwards and take advantage of the trip. Then we hook the structure a little bit and we would change to the last oblique, okay? Which is a downward oblique, a horizontal, and an upward oblique, in which we would throw, which is the technique. We come in with the elbow. We pick up and we rub until the hand arrives and we hook. It is a very good technique. There is another technique to work what is the lumbar square with reinforced fingers, 10 lines. Hooking, oblique upward, horizontal low down and gancho equally. And down and gancho equally, this 10, 10 and 10. As I say, if you can't be guided by time, which is half a minute, 1 minute each technique, you can do 10, 20 times each pass. And that way you know you are not overdoing it. Another forearm technique, which is going to come in handy. Basically, we never apply the cream directly to the patient because it is cold and he will defend himself. So always on top of our little hand, forearms. Look what a cool combined technique. We reach the lumbar square with our hands. We put our forearms, and one goes towards the gluteus and the other towards the dorsal. We recover, we hook. We recover, we hook square lumbar with the two hands in V. We put the two ulnar, we put the forearm, and we recover by touching the patient. We do not lose contact. We do not do this and leave and start again. We have to be in continuous contact with the patient with no tension, and this has to be very relaxed. We do not have to lie on top of the patient. It has to be pleasant. The patient is liking it. And okay if the patient is liking it. And okay if the patient is liking it. And okay, we have the okay. It does not hurt. He has not told me anything, so we continue. How many times do we do this on each side? 10 times. As you can see, it is a technique in which we use our body. We don't use our arms. We are simply, the arms are supported. Yay. And we generate this wonderful technique of forearm massage. Yeah, before I finish, I'm going to do techniques that I usually do every day, which are a mixture of everything you have seen. I am going to sequence them. This is the way I work. Many times the lumbar and the lumbosacral area. I sometimes find it hard to describe and I want you to see, so I leave you the summary of these techniques. I won't give you any more trouble talking to you and you will see this. Well, to finish these massage techniques, which we have started with 5 minutes of soft massage and 15, 20, 25, 30 minutes of soft techniques, remember, we are going to finish with 5 minutes of relaxation. After what has been this dance below, you have to slow down slowly. You have to give a lot of love to the body again, making circles, relaxing and inducing the patient to calm down for at least 5 minutes. For at least 5 minutes. We go back to palmar therapy, in which we can do the Miyagi-san, Cobra Kai, how cool that series is, and we are going to relax the patient and we are going to induce him to be calm because we have finished. When we are done, I recommend you to cover the patient, leave the patient calm, whether it is a brother, sister, father, mother, brother, friend, whatever, and put your hand on that one. We lean a little bit, as you can see, like the one who leans a little bit on a railing, and we are going to go forward, backward, left, right. Circle, 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 circle for at least 2-3 minutes. then it is very important to tell the patient, you get up whenever you want, take your time. If you have a little bit of heat and you apply a little bit of heat with a bag of seeds or with an electric blanket, it would be great. But the patient should not get up in a hurry because the blood pressure drops, and when the blood pressure drops, a patient gets up quickly and gets dizzy. So slowly, when you want to, we get up. Well guys, we have reached the end of the video. Thank you very much for being there. If you have questions or want me to do a massage in another area of the body or describe more massage techniques, tell me in the comments. Give us a like if you liked the video. Subscribe to the channel if you want to continue receiving this piece of content that we do just for you. And as I always say, until healing and beyond. See you. Bye.
Thanks to all of you.